Plantar fasciitis is inflammation or irritation along the plantar fascia. The plantar fascia runs along the sole of the foot, so it comes from our calcaneus or our heel bone. It runs right the way along the sole of the foot and it goes into our toes. It's very common in runners or people who are walking a lot, anyone who is heel striking quite often. Most people get the pain around their heel, so the point of pain is in around there. It can happen anywhere along the plantar. Tend to find it happens in the arch along there as well. Tends to be a bit of a trigger point for it, and we will focus on that area in a bit. Runners are more at risk of this due to the high nature and high load of running, but a lot of people can and do suffer with this. The idea or the rehabilitation movements, we're going to try and get a nice little stretch into that plantar. So we're going to be using our toes quite a lot because it attaches at the toes. And we're also going to try and strengthen and control our arch height. So people with flat feet or collapsed arches or people with high arches tend to be more at risk through plantar fascia. The muscles that control that are muscles that come from our lower leg, so we're going to be working our lower leg as well as we're going to be controlling and getting the muscles in here to activate and to fire. The first thing we're going to do is try and move and get that plantar on stretch. To do this, we're just going to take ourselves through a walking motion. So we're going to go from dorsiflexion through to plantar flexion. So we want to just relax our foot onto the floor, do this barefoot, and try and do it on a slightly soft surface. So you don't want to be doing this on a hard surface. I've got a yoga mat here, which is perfect. And then all we're going to do is just relax your foot into the floor, and then from there you just want to dorsiflex, really try and point your toes back up towards the ceiling. You'll feel it work in the anterior muscles in your leg here, and you'll also feel your plantar is getting a nice little stretch by doing that. From there we just want to roll through, let your foot hit the floor and contract and relax around the floor, and then just go through the walking motion and really stretch your toes. It's almost as if you're about to push yourself off. Hold it there and you'll feel a nice stretch going through the plantar. You might feel it's a little bit sore at where you're getting your pain. As long as you're comfortable with that soreness, then that's a good sign. And again, we're not pushing our foot off, so we're keeping our toes down. The closer we can bring our knee to the floor, the more of a stretch we're going to get into that plantar. And then again, reverse that. So we're going to roll back down, let our foot relax into the floor, and then point our toes back up towards the ceiling. By doing this, we're just getting all the muscles within our foot to relax and then to start engaging when they need to, and we're also working the muscles in our lower leg. So if we go through it again, foot relaxes, and then we're going to stretch those toes, knee down towards the floor, and get a really nice stretch into that plantar fascia. And then repeat through that. You can do this before a run. It's a nice little activity to get the foot nice and loose and then really push off. The more you do it, try and advance that stretch each time. So push it a little bit more. Okay, the second exercise we're going to look at is again going to focus on the muscles that control our arch height, which are all located in our lower leg, just in here. For this, we're going to use a tennis ball. So obviously you have your normal calf raise, which I would still do as well. So we're going to do 5 normal calf raises, nice and slow and controlled, especially on the down phase. So that eccentric movement for your calves, really important to get that as well. So don't just get to the top and drop down. Nice big squeeze at the top and then control down. Nice for the Achilles, that one as well. So from there, we're going to put our toes together. We're going to put the tennis ball between our heels, and then we're just going to squeeze the tennis ball just enough so you can feel a little bit of movement in the ball. And then again from there, slowly raise up. A little bit harder to keep your balance on this one, so nice and slow on the first few times. And again, keep the squeeze on the tennis ball, really important. You should feel, rather than the engagement or muscle tension coming from in here, you should start to feel it a little bit lower down your leg onto the medial side. If you don't, make sure you keep squeezing your heels together and you'll feel it lower down. And again, go for 5 of those and then alternate between your standard calf raises and then with the tennis ball. From here, and I'll show you on my right foot so you can see what my arch is doing. Again, we're going to go foot flat on the floor. Let it relax, just let all the muscles relax into the floor, and then we're going to try and increase and decrease our arch height, so trying to get control of that arch. To do this, we can just contract our foot up and try and bring the ball of our foot back towards the heel and just get that to contract, so shorten the plantar, and you can see when I do that, my arch height just increases. And then I'm going to relax and I'm going to try and stretch my toes and push my foot into the floor. And then reverse that, so crunch and relax. So just opening up that arch height. To help us focus on this or do this, we can, I've got a little stretchy band here. Put that onto the floor, and you want to stand on the band, and then you want to squeeze down as hard as you can. So really try and flatten out your foot onto the floor, squeeze onto the band, so you can then come and pull that band. Use your feet, muscles in your feet to contract your arch, squeeze it into the floor, and then you can get a nice pull on that band. So if my foot is relaxed, and then squeeze in, and that shouldn't move. And again, you'll feel that working down in your lower leg, because that's where the muscles are that control your arch height. From here, we're going to go into some self-massage, and then we're going to try a bit of soft tissue release as well. So you can use a tennis ball, you can use a massage ball like this. If you have a golf ball, you can use a golf ball to really get into the tight spots. All we're going to do is start with the lesser ball. So in this case, for me, it's going to be the tennis ball. The massage ball is quite spiky, so it hits the real tight points. And then obviously a golf ball is smaller again, so smaller surface area. And to start with, we just want to roll our foot on the tennis ball, not too firmly, so we don't want to be causing too much pain at this point. All we're trying to do is get our foot to relax around the tennis ball. So you shouldn't, at this point, your foot should be nice and relaxed. If you feel your foot is tensing up because it's a little bit sore, then back off of your pressure. So we want our foot to mold around the ball like that. So we want it like that. We don't want it to be like that where it's resisting the tennis ball. And just roll all the way along that fascia. Again, trying to find the sore points. So coming up over the heel and then really getting into that arch. We want to go longitudinal, so we want to go forward and back on the foot. And we also want to go transversely, so we want to go side to side on the foot. Again, if you find a bit of a sore point, just little oscillations around that. As we become more comfortable with the discomfort of this, we can start to increase our pressure on the ball. Again, go right into the toes. We can also go up onto the ball with our toes, and that gets a really nice stretch into each individual toe and the plantar fascia again. Then progress onto your next ball, so whether that be a golf ball or whether that's the massage ball in this case, and do the same thing. So start with lighter pressure, and then work your way into it as your foot relaxes around the ball. Okay, we'll come into soft tissue release as the last form of exercise we do. The next thing we're going to do is to try and strengthen a little bit. So we're going to do tiptoe walking and heel walking. If you've seen the shin splints video, this is also in there, so it's the similar muscles we're trying to work. So we're going to go up onto our tiptoes, and we're just going to walk along. By doing this, our foot is having to work quite hard to keep us in that position. So we get a nice engagement of the foot and the arch height. We're going to go out and back, and we're going to do that 5 times. And then we're going to swap. We can alternate if you want, so you can go out and back doing that, and then you can go up onto your heels and go out and back doing heel walking. Again, on this one, really try and exaggerate the toes pointing back up. The more you can get those toes pointing towards the ceiling, the more of the stretch that plantar fascia goes into, and that really is what we are after. The last exercise or rehab thing we're going to do for our foot is a bit of soft tissue release. We can do this with a tennis ball, or you can do it with your own hand. It's up to you, whatever you find it easiest. So what we're going to do is we're going to crunch our toes. We want to shorten that plantar fascia. So if you imagine where it runs to, we want to shorten it. So by doing that, we can shorten it, and then by extending our toes out, we lengthen it. So all we're going to do is shorten the plantar by crunching our toes as much as we can, and then we're just going to place our thumb onto or just before the trigger point. So if we find that our trigger point is here, what we're going to do is crunch, shorten the plantar, go just before it, and then really slowly just extend out our toes. Crunch the toes back up, take your pressure off, move slightly down, and same thing. Squeeze in with your thumb and stretch out. That is going to be quite sore as we stretch it out. But again, as long as we're comfortable with that pain, we can keep increasing the pressure where our thumb is. So again, pressure off, crunch your toes, pressure on, and stretch. And work all the way down the plantar doing that. So working through the arch, and then come back up, start again, and work down the middle of the plantar. Bearing in mind the plantar goes into each of our toes, so we have one thick band and then it spreads off into thinner bands at the toes. And again, you'll find little sore points throughout, so if you do, focus on a little sore point. So there's one just there for me. And again, just keep squeezing it as it relaxes away. So pressure off as you crunch your toes, pressure on as you extend them. And it's a really nice way of getting a soft tissue release or an active stretch into that plantar fascia. Don't want to overdo this, so don't spend ages sitting doing this. Maybe spend a couple of minutes doing it, and then let the foot relax down. So once you've been through this whole rehab video, do this towards the end and then just let it relax. Try and get your feet up if you can, just to get all the blood flowing away from it. Okay, and then we are done. So try and repeat those exercises. If you can do those sort of twice a day, including the soft tissue release, it really will help. Obviously, if your plantar is particularly bad, it might be worth taking a little bit of rest, but again, we will guide you through that on the back of treatment. Try and avoid repetitive use of it, so things like running for a bit, and really focus on the rehab side, strengthening and getting control of your arch. I hope that video helps. I hope that helps alleviate some of your pain, and I hope you find it useful. Thank you for watching, and stay tuned for more content.